I'm just going to make a few remarks and then turn over to my colleagues and the advocates. The reason we are having this program this morning is that Republicans are running scared on health care. The fact is they are trying to defend the indefensible, rolling back protections for those with pre-existing conditions. This means you're taking health care back to the days when health care was for the healthy and wealthy. They're trying to defend junk insurance, and this really takes my breath away. Their new approach on navigators, the folks that help people select their health insurance, basically involves federal funding fraud, because the new policy would actually pay the navigators to find a way to get people to these junk insurance policies, which are worth little more than the paper they're written on. So what we have seen over the last year and a half is that when folks at the grassroots get involved, led by the inimitable Little Lobbyists, people understand what's at stake and we win. We all remember what happened when John McCain was the deciding vote. We understand how relentless the far right is. Senator Stabenow and I serve on the Finance Committee, and we saw how they essentially tried to hijack the tax bill to hurt people, to raise insurance premiums in the tax legislation. And what we want people to understand is a vote for Judge Kavanaugh is a vote to send the Affordable Care Act into the dustbin. It is a vote for repealing the Affordable Care Act. The President of the United States said that that was his agenda. He clearly was looking for judges who had demonstrated a sympathy to rolling back the Affordable Care Act, and he got that with Judge Kavanaugh as well. So we're going to be, over the next few weeks, trying to make sure the American people understand what's at stake. Where is our clock in this room? Right over there. Right over there. What this is really all about is whether we're going to turn back the healthcare clocks in America. And literally, when you look at the pre-existing condition issue, go back when the American people want to go forward. I'm heading home in a few hours for town hall meetings. I'm going to hear from people who want to go forward on health care, not go back to the days when the insurance companies could beat the stuffing out of somebody if they had a pre-existing condition. So we wanted to use this as a chance to once again show that we're going to make a big push at the grassroots on what we think is the central issue, is a vote for Judge Kavanaugh, is a strike against all of those people who might have diabetes or asthma or a pre-existing condition, because the record shows that he will want to repeal those core provisions. My seatmate on the Finance Committee, Senator Stabenow, is here, and I'm going to turn it over to her, followed by Senator Murphy, and then
thank you.
We're on with the show with the lobbyists.
Thank you. Well, thank you, Senator Wyden, for your ongoing leadership on health care and really keeping us focused on what's most important for people in Michigan and across the country. And Senator Murphy, a strong, passionate voice for affordable health care as well. And I want to thank Leslie and Catherine and Samantha and Josephine. Thank you for being here today and joining us, because this really is about you. And we're very grateful that you're here. You know, it was a year ago this Saturday when the people of our country rose up and joined together and helped us stop the legislative repeal of the Affordable Care Act. People said no, And in theory, the votes were here to do it with the majority party, but people rose up and said, my health care is personal, not political. And in the end, we stood together and said no. Now, we have a 1-2 punch happening now as the second phase, though. One is that the Trump administration is changing the rules to gut affordable health care from the inside out, allowing plans that don't have to cover pre-existing conditions or plans that can jack up the cost on pre-existing conditions, take away other kinds of coverage, refusing to defend the Affordable Care Act on behalf of all the Americans who said they want affordable health care, comprehensive health care. And then the second piece is putting a justice on the United States Supreme Court that the president knows will, from a Supreme Court perspective, follow through on his desire to rip apart health care in this country. When the administration refuses to defend the law that protects people with pre-existing conditions, I take it personally. And you know who else takes it personally? The estimated 130 million people who could lose their health care if this law, if the lawsuit succeeds. 130 million people. And I've heard from so many of them in Michigan. People like Louisa, a beautiful little girl who was born with half a heart. People like Amy, a small business owner who's living with chronic leukemia. People like Darren, who's worked hard to get his diabetes under control. All of them with pre-existing conditions who now face a prospect of no health care or unaffordable health care. And people like every single woman in this room today. I remember fighting to cover maternity care as an essential benefit for women, and now that is essentially in jeopardy, and plans, and most plans being offered with these new rules don't cover maternity care. And the fact of the matter is, I remember when just being a woman was a pre-existing condition, and this administration wants to take us right back there. We believe, Democrats believe, that health care is a basic human right, not a commodity in this great country, a basic human right. And that's why all 49 of us stood together to introduce a resolution to defend, to intervene in the current court case. That's what our president, on behalf of the American people, should be doing. They're trying to turn their back and turn the clock back, as Senator Wyden said, to a time when really and truly insurance companies decided, could you get coverage, what kind of coverage, and what the price will be for you to get the basic health care you need for you and your family. On behalf of Louisa, Amy, and Darren, and so many people in Michigan, we're going to keep fighting for them, whether it's the right people on the United States Supreme Court or the right rules and the right health care policy in our country. Health care is a basic human right. Senator Murphy.
And as Senator Murphy comes up, you all should know that Senator Murphy has been our go-to person in the Senate in terms of organizing these kind of events. We're very appreciative he's here.
Well, listen, Ron and Debbie, thank you so much for your tremendous moral clarity on this issue, making people understand what the stakes are. Since the Affordable Care Act was passed, the number of personal bankruptcies in this country have been cut in half. That's a stunning statistic. 50% less people go into personal bankruptcy today than prior to the Affordable Care Act. And the reason for that is simple. Very few people in this country now lose everything, their savings, their house, their college accounts, because a loved one goes sick, because they have protection against those high costs for people with sicknesses, illnesses, and pre-existing conditions, and we have affordable health care for everyone in this country. And so the stakes here are just so enormously, enormously high. I think about a family in my district who didn't have the protections of the Affordable Care Act because their illness, their diagnosis came before those protections were passed. Betty Berger's husband had been employed his whole life. He was without a job for 1 week 1 week he was without a job, and during that week their son got diagnosed with cancer. And because of that diagnosis, his new employer would not cover his son under a family plan, discriminated against because of his son's pre-existing condition. To take care of their son's cancer, the Berger family lost everything. They blew through all of their savings. They had to sell their house. They went into financial ruin simply because of a diagnosis coming at the wrong time. That should not happen in the most powerful, most affluent country in the world. And as Senators Wyden and Stabenow said, Donald Trump's desire here is to override the will of the American people and go back to the days in which insurance companies were in charge and millions of families went bankrupt simply because of a diagnosis. He said it plainly for the American public to see at a rally about a month ago. He said, don't worry about the fact that we couldn't pass a repeal of the Affordable Care Act because we gutted it anyway. President Trump is bragging all over the country that he is in the process of gutting protections for people with pre-existing conditions, gutting the Affordable Care Act so that people can't afford insurance any longer. And certainly a big part of that plan is the regulatory attack that he has launched on the Affordable Care Act. But the next step is a Supreme Court that will overturn the Affordable Care Act once and for all. And he told us this during the campaign. During the campaign, President Trump told us that he was not going to make the mistake of nominating someone to the court like John Roberts, who would uphold portions of the Affordable Care Act. He would appoint people to the court who would do the opposite. So we need to remember what we did last year. A lot of people said when Republicans took over the House and the Senate and the White House that it was a done deal, a foregone conclusion. The Affordable Care Act would be repealed, that there was no way for us to stop it. But we didn't listen. You didn't listen. These families didn't listen. They came to the Capitol day after day after day and did not take no for an answer. The night of the vote, they were out in front of the Capitol protesting until the very last roll call name was announced. And in the end, the American people won. And the special interest groups and the Trump agenda lost. And so don't let anybody tell you that we can't stop the Kavanaugh nomination. Don't let anybody tell you that this is a lost cause. If we put together the same kind of mobilization on behalf of families like these, then there is no doubt in my mind that we will achieve the same outcome, the defeat of Brett Kavanaugh and the protection of protections for people with pre-existing conditions all across this country. So really glad to be here with some true heroes and some true champions to kick off this portion of the program. Let me ask Leslie Dach of Protect Our Care to come up.
Yeah, and as Leslie and the families come up, they are living examples of the power of the grassroots, because without them, Senator Stabenow and I in the Medicaid fight in the Finance Committee, we're not convinced we could have won without the incredible grassroots work that the families and Leslie did. So come on up, Leslie, and tell us how we're going to do it again.
Thank you. Morning, everyone. I want to start by thanking Senators Wyden, Murphy, and Stabenow. Thank you for all that you do every day, and all of your colleagues have done to save health care in America. If you and the other Senate Democrats had stopped even for a day in this fight, the law and its protections would be long gone. And I, of course, also want to thank not only the little lobbyists themselves, but also their parents who make these trips to Washington, who fight every day on behalf of their families. They live this fight, and thankfully they're winning this fight so far. You know, President Trump may see the stinging defeat of the ACA as the most irritable moment of his presidency, but for the rest of us, it's really a moment of inspiration. Because we saw that when people take to the streets, when they stand up, when they speak out, when they do the work, we can win, and we can stand up for what's right and what's good in America. And we'll hear about that in a little bit from Catherine and Samantha and Josephine. I also want to thank Aaron and Abby and Bridget, who also made a long trip from Pennsylvania to be with us today. The Affordable Care Act has made a tremendous difference in people's lives. The uninsured rate cut in half. People are healthier. They're not an emergency away from debilitating bankruptcy. Insurers can no longer deny coverage to people with a pre-existing condition. They can't charge women more just because they're women. And they can't deny cancer care and maternity care and substance abuse care to people who need it the most. We also protected Planned Parenthood health care centers, for which for over 100 years have provided essential health services to people around this country, caring for 1 in 5 women over the course of their lives. You know, Americans don't want any of this taken away from them, but President Trump and the Republicans in Congress are actively working every day to do just that. They're sabotaging our health care by driving premiums up, by threatening women's health, and by relentlessly pushing legislation that will gut Medicaid, threaten all these important things that people rely on every day. And they do this at the same time that they voted for a tax bill that gave billions of dollars in tax breaks to large drug companies, large insurance companies, and while their CEOs' salaries skyrocket and while profits soar, the people I'm standing next to pay more for drugs and pay more for insurance. But for all the things that President Trump and his allies in Congress are doing, nothing is more cruel than what they're doing to families and individuals with pre-existing conditions. Their attacks on these people, and that's what this is, are the cruelest of all. You know, all of us in this room know somebody with a pre-existing condition, and many of us have one ourselves. Cancer, heart disease, diabetes, asthma. Children born with life-threatening and lifetime illnesses and disabilities. And now, as senators have said, what they failed to do in Congress, Republicans want to do in the courts. President Trump has gone to federal court to declare protections for pre-existing conditions illegal, an unthinkable act. And he's nominated a person for the Supreme Court who has passed this president's 2 litmus tests, a nominee who will vote to overturn Roe v. Wade, and a nominee who will vote to take away all our health care. A nominee who criticized the Supreme Court's prior decision to protect the Affordable Care Act and has said that presidents are above the law and can simply ignore laws they don't like. That's why today the fight to protect our care and stop this nomination is as urgent and as energized as it ever was. That's why all the people who went to town hall meetings, who marched, who spoke out, who came here to the Capitol and continue to do so to make their voices heard, are doing it and will keep doing it. They won't stop until this threat is over, because nothing short of our lives, our future, and that of our children is at stake. So thank you all for being here today, for raising your voices, and now it's my pleasure to hand it over to Catherine.
Catherine and Samantha, why don't you two just come on up and run the rest of the program as you would like.
Come on up here. Hi, folks. We'll wait for Samantha to come on up. So my name's Catherine. I am from Portland, Maine, and there are very few reasons that I would leave coastal Maine and come to Washington, D.C. in the middle of the summer. But this matters, and Mainers' health care and their rights matter. Every time I see the Trump-Pence administration and leaders in Congress chip away at women's health care and their rights, I am fired up to take action. Last year, I raised my voice, I called my senators, I shared my story, and we stopped a bill that would have harmed the lives of millions of Americans and devastated Planned Parenthood patients like me. So a few years ago, I graduated from college and into a recession, and because of the Affordable Care Act, I was able to stay on my father's health insurance. For the most part, I was lucky, but my plan was grandfathered, so it did not include benefits that protected and covered my birth control. At the time, I was working as a part-time tour guide, and I didn't make enough money to cover the cost of my birth control. But Planned Parenthood was there for me, so that I didn't have to make a choice between groceries and my health. I was so grateful that I had access to a welcoming, non-judgmental care provider that I could afford and that could meet my needs. And a few years later, I returned to that same Planned Parenthood with a new health insurance plan. This time, I was looking for a long-acting type of birth control called an IUD. And because the Affordable Care Act specifically named birth control as an essential health benefit, this time, my care was completely covered. If the Affordable Care Act had been repealed and my access to Planned Parenthood had been blocked, that IUD would have cost me $1,000. So I'm proudly standing here today because Planned Parenthood and the Affordable Care Act helped me to access the kind of reproductive health care that should be normal and expected and accessible everywhere. Last year, I was one of the thousands of people who came to DC to express our opposition and our outrage at the various pieces of legislation that had been proposed, all of which would have left tens of millions uninsured, would have returned us to a time when being a woman was a pre-existing condition and prevented millions of people with Medicaid coverage from coming to Planned Parenthood healthcare centers for basic preventative care. And now I'm back because many men in power keep coming after our healthcare. They've already implemented a rule eliminating the guarantee that your health insurance through your employer will cover birth control. They implemented a rule eliminating that guarantee. They've also made it easier for health insurers to avoid covering essential health benefits like maternity and newborn care, mental health care, and emergency services. They've proposed cuts to Medicaid expansion, which is a crucial part of the ACA, and it provides health care to people who would otherwise not be able to afford it. And now they've nominated a judge who, if confirmed, could decide to strike down the health care protections that I and millions of other Americans rely on, like birth control and protections for people with pre-existing conditions. Or he could decide to destroy the Affordable Care Act altogether. This is why I'm here today. I've seen firsthand that the voice of the people is powerful. When I spoke to Senator Collins last year about this issue, she listened. Now that President Trump has said that he would appoint a judge who would overturn the ACA and protections for people with pre-existing conditions, I'm raising my voice again. I am calling for the Senate to listen to the millions of people like me across the country and to protect our health care. Thank you. I'd like to turn it over to Samantha McGovern.
Yes, thank you. Rose, can you bring Joe? Yeah. Hi, Peanut. A year ago today, I stood behind the Capitol with my fellow Little Lobbyists and citizens who felt that accessible, affordable health care was worth fighting for. I will never forget the weight that lifted from my shoulders and my heart the moment that I heard that the skinny repeal had been defeated. But whatever relief I felt this time last year has long gone away while the campaign to sabotage our health care continues. This is Josephine, my 2.5-year-old daughter who was born at 24 weeks. Unlike last year, I can now say that she has spent more of her life outside the hospital than inside of one. Josephine will sit for stories as long as anyone will read to her. She stacks blocks, plays with trucks, and will do almost anything for bubbles or time in a swing. Thanks to the therapy she receives 4 times a week, she is now working on walking with the use of a gait trainer. She can eat by mouth, making her less dependent on her G-tube. She is learning how to communicate via sign language and an assistive technology. Today, she can now breathe for periods of time without the use of her ventilator. Because of the medical care that she has received and continues to receive, life for us today is full of promise, progress, opportunity, and options. But no matter what barrier she overcomes, Josephine's future will still be full of doctors' appointments, hospitalizations, home medical equipment, therapy, and specialists. That's the reality of the life of a medically complex child. Without the protections afforded to her through the ACA, Josephine would certainly have hit her annual or lifetime maximums without much effort. Her first hospital bill capped out at just over $7 million. Her monthly medical expenses come close to $40,000. A big portion of that is our private duty nursing. While our employee-sponsored insurance covers a lot, it does not cover our private duty nursing, which is covered by Medicaid. Josephine requires 24/7 trained caregiver. While this can be her dad and I, without a private duty nursing, one of us would always have to be awake. One of us would certainly have to quit our jobs. Parenting and caring for a medically complex child is really hard. It's exhausting and consuming, and just to manage the day-to-day. You're constantly fighting for everything your child needs to thrive, because that is what parents do. But every fight is time I have to spend away from her, my little girl. So the last thing I want to do is fighting again, still, for access to affordable health care, something that should be a basic human right in 2018 in America. Only this time we aren't fighting legislation, but rather the slow dismantling of the ACA through backhanded channels, such as allowing junk plans back into the market and changes that will increase premiums, making the ACA plans less affordable and inaccessible to the people who need them most. We don't need to go back to a time when major health issues bankrupt families. Catastrophic healthcare events happen to anyone at any time. All Josephine did was be born the beautiful girl that she is. She was born early, very early. Not her fault, not my fault. But without the protections of the ACA, our family could be bankrupt by this. Josephine could be discriminated against by the insurance companies. Our family is not unique. There are thousands of us out there. We are scared. If the ACA is successfully dismantled, if even a few key pieces are removed, if Josephine can be discriminated against by insurance companies for her pre-existing conditions, if lifetime or annual maximums were to return, if cuts to Medicaid were implemented, my family's life as we know it will shatter. It is for this reason that I'm here again today, continuing to tell our story, continuing to tell Josephine's story, and asking our leaders in Washington to stop the crusade against healthcare.
Samantha, thank you and the Little Lobbyists for being the human face of what this fight's all about. Let's throw it open to questions for a couple of minutes for folks that have some. Yeah.
According to a recent survey, roughly 70% of the Democratic nominees that fell through the primary process on the House side in swing districts are supportive of the Medicare for All plan. Your colleague, Senator Bernie Sanders, really kind of emphasized that a big part of his campaign back in 2016. Is that something that you think that Democratic leaders would move forward on if they retook the House or the Senate?
Let's talk very specifically about what today is all about. Democrats have plenty of ideas for moving forward, particularly on matters like holding down the cost of prescription drugs. We are to an individual, every single Senate Democrat is going to fight the effort to go backwards, to turn back the clock, particularly on pre-existing conditions. That's what we have to tackle right now, because we believe, and I was also looking at Judge Kavanaugh's comments criticizing John Roberts specifically on some of the key points with respect to his upholding the Affordable Care Act. What we've got to do now, and why we are all completely united a year into this battle in terms of making sure we don't turn back the clock and unravel this key protection. And by the way, Senator Stabenow knows this. We had a piece of legislation with 7 Democrats and 7 Republicans. And the key provision there, much of which went into the Affordable Care Act, was loophole-free, airtight protection against discriminating against people with pre-existing conditions. And you just heard our friends talk about what it would mean for them. So I'm going to be having town meetings here in like 24 hours in Oregon. I'll hear plenty of ideas for going forward. What the group will want to hear first is how we're going to make sure we don't go backward. Maybe Senator Stabenow and Senator Murphy want to add to that.
I would just add to that. I think in addition to the fact that job one right now is to make sure we don't go backwards, that people don't lose our health care and protections, and that insurance companies aren't put fully in charge, again, of people's health care. Second, every single one of our proposals as Democrats, I'm proud to say, increases people's health care, every one of them, and lowers their costs, tackles prescription drug costs and prices in a number of different ways, and tackles other costs. Every single Republican proposal takes away health care and raises costs. So we stand together unified that health care is a basic human right. We want a universal health care system. And I hope we have the opportunity to be in the majority where we can then debate all the wonderful options we have on how to move forward to make that a reality.
On that point Senator Stabenow made about the Republican proposals and the consequences for people of going backward, I think we all remember how incredible the Little Lobbyists were in defending Medicaid. We will have in the Finance Committee a proposal to essentially gut the safety net of Medicaid. It's called Graham-Cassidy. It would turn Medicaid into a block grant, illustrating the point Senator Stabenow's made. Any other questions?
What do you make of the Trump administration's decision announced earlier this week that they're going to resume risk payments to health insurers? Does this show that maybe they're getting some second thoughts on undermining Obamacare, or are they trying to buckle given that this Democrat is a political issue?
What is striking about the risk adjustment change is that it really highlights that they are running scared on health care. The most telling part of that announcement is when it's going to go into effect. It's going to go into effect October 22nd. Now, what a surprise. I heard a rumor that an election comes up in November. So I think that this is all part of their running scared. For 7 years, they said they were going to repeal and replace the Affordable Care Act. When their dog caught the car and they had all the branches of government, they didn't know how to do it. And now, as my colleagues have said, people are getting hurt because of their policies, because of their sabotage. And that risk adjustment change, which goes into effect a few days before people have ballots in their hand. In fact, in my state, that's when people are going to be thinking about voting. I think is transparently a reflection of the fact they know their health care policies are hurting people.
How much of an impact will that have if they do resume these payments?
Well, there are two pieces to the puzzle. The risk adjustment issue, we'll still have questions of cost sharing. Nobody has any official scores. We know that they've already made it hard to hold down the rates because when they changed the purchase requirement, the healthy people leave the insurance pools, so prices go up, not just on the people in the individual market, but employers as well. So this certainly is something they should have done a long time ago. My sense is it will have some help, but we can't give you a figure today in terms of what it would do to premiums.
And if I might just jump in and say, politically, it's not going to make any difference. It's just not going to make any difference. Something coming, first of all, people know that this system is being torn apart from the inside. And the people here know that. So some slight, some change that comes a week before the election, after rates are already out, most of the rates are either being published now or will be published earlier in the fall, will be viewed for what it is, which is politics.
The Trump administration has talked a lot about, and Trump talked a lot about it in his campaign about prescription drug prices. President Trump said recently he's met with some drug company representatives, including Pfizer, and that they agreed to him to not raise prices. I would love to get kind of y'all's opinion on that.
Listen, the president's all talk on drug prices. He hasn't done anything meaningful to reduce drug prices. All he's done is support legislation that would pass along a massive tax break to the drug companies. Ask anybody in this country whether their drug prices, the amount of money they're paying out of their pocket, is coming down for drugs. The answer is an unequivocal no, certainly in my state. Unless you get serious about doing things that the drug companies oppose, like bulk negotiation, then you're not going to make a difference. You're not going to reduce drug prices by asking the drug companies to reduce prices. You are only going to reduce drug prices by electing a majority in the Senate and in the House of Representatives who are going to take on the drug industry. President Trump has put out a piece of paper, but has effectively done nothing about the issue of drug prices, and conversations with the drug companies are simply not going to get you there. And I think Americans know that. Americans see their drug costs spiking through the roof, and they know that ultimately this is going to be an issue that will have to be taken to the electorate.
To underscore that, the largest sector of lobbyists here in Washington is the prescription drug lobby. There's about 1,500, almost 15 for every one United States senator. And the only group that's been willing to stand up and take them on is the Democratic caucus. And I would ask that the president show us that he's serious by doing something that his own commission on the opioid crisis recommended a number of months ago. We have an opioid crisis. The president has indicated that. We know that. We have a medicine that is life-saving. If someone's in an overdose, it's called naloxone. It's administered in different ways. It's called Narcan in some places. This is a medicine that was developed in the 70s, off patent, as late as 2005, was sold for $1 a vial. Then we had an opioid crisis. And as of this last year, we had one company selling it for $4,000. We have 600 and some dollars. Now we're down to $150 for a 2-pack. The President's Commission on the crisis recommended, given the fact that this is a national crisis, that he negotiate with the companies to get the lowest bulk price, as Senator Murphy was talking about, lowest bulk price. His own commission recommended that. I asked the head of HHS if that was going to happen when he came before the Finance Committee, and certainly he did not indicate yes. So if they want to get serious, rather than asking the drug companies what they are willing to do, he should take his own commission's recommendation, because what's happening now is law enforcement, EMS workers, emergency physicians that use this drug every day in the emergency room are spending taxpayer dollars for a high price for something that back in 2005 was sold for $1 a vial. So that's the action he can start with.
For the millions of consumers who are getting clubbed over the head when they're at a pharmacy window, this Trump proposal, there is no there. And it looks like they're getting ready to make it even worse. There's a program, I was involved in it when I was a young member of Congress. I know my colleagues have been supportive of it, called the 340B program,
yes,
which is a program that gets additional relief to the safety net facilities. And it looks like they want to roll that back as well. And as Senator Stabenow said, we have real proposals. For example, in our program, in effect, the Better Deal, it includes something I've worked on with my colleagues for quite some time called the Spike Act, where if there are major increases, you'd have to justify them. So Senator Murphy, I know, has got to run. A bunch of you, I'm sure, would like exclusive interviews with the Little Lobbyists. I want to thank Senator Stabenow, Senator Murphy, Leslie. All of them might stick around for a couple more minutes. But 1 year from this time, we showed the power of the grassroots. We're going to do it again.
That's right. That's right. Thank you. Thank you so much. I'm running.
Oh, my pleasure. Thank you.
Well done. Thank you very much.
Oh, my pleasure.